Good evening, all of you. Collaboration that is going to happen between Avis Hospitals and Medtronic. But before we start, let me call upon Dr. Rajagopala, Pratik Tiwari from Medtronic, Dhara Shah from Medtronic, and Balveer Chandrawat from Medtronic. Please be seated.
What we have as a prevalence for varicose veins in India at the moment. And this is where we are together, gathered over here to figure out a solution and how do we go ahead with it. And with that, I'd like to call upon Pratik to give a little bit understanding and idea about what Medtronic as a company is all.
So, hi, good afternoon everyone. My name is Pratik Tiwari. So about Medtronic. Medtronic is a global healthcare technology med device company. We have presence in around 150 countries across globe. And Medtronic was established in 1949 in Minneapolis, USA. We are covering therapies and critical therapies and products which are like, for example, varicose veins, colorectal, stroke, neurovascular, neuromodulation. These are therapies which are very, very groundbreaking therapies, and we have products and solution for each one of them. Talking about a little bit about India. In India, Medtronic has presence in 3 businesses, and just to make it simple, the first business is CV business, which is dealing with stent and pacemaker. The second business is medical surgical, which are dealing with suture, hernia, staplers, and many other surgical range of products. The third business is neuro and specialty. In neuro, we have products which are capital machines, implants used in neurosurgery, spine surgery, ENT surgery, stroke, neuromodulation, ENT, and in specialty we have therapies which are like TAVI, endovenous, peri, diabetes, and many more. So this is what the India Medtronic presence is, and really happy to be part of the collaboration.
Thank you so much, sir. Thank you for coming all the way and sort of appreciating the kind of efforts we put in to create this as a mainstream. I always felt vascular interventions, peripheral vascular disease should be, I mean, there's enough numbers, like she said, equal to cardiology, equal to cataract, equal to the 10 commonest diseases we have in the country. This is equal to that. However, somewhat due to turf wars, as in who's the right doctor for this, the turf is not clear. Somewhat due to the fact that all along there were such good numbers in cardiology or wherever other specialties that nobody took enough importance to this field. So this is where I have a little complaint for you. So when I go to a vein congress in US or UK, I mean I traveled at least 3 vein congresses a year. I mean Medtronic owns it. I mean literally, like, they are the first stall, they're the biggest stall, they're the. I think I request you to be more present in the peripheral vascular segment. Initially, you will not see the same returns and results as maybe something else, but you will in 1 year's time. I trust me. Right today, you saw a 90-member call center. I'm not able. It's not that I'm paying their salaries from my personal pocket. It's for the business that's making that kind of money. So superficial venous disease is so common. So well paid. It's a very good business opportunity. Of course, like everything else in healthcare, while you make a profit, you can save a life also. It's not like, profit comes out of somebody else's life. So I think I goad you, your seniors. I request you to sort of think about this as a serious business line, serious line of line, and then create the appropriate infrastructure. In terms of patient awareness, doctor awareness, and multiple ways. But that's just an advice. But at a patient level, as an experienced doctor level, I'll tell you 2 incidents that make me laugh. One incident was in a very large vein WhatsApp group. One gentleman has posted, my laser tip broke. And the other gentleman said, no, don't worry, leave it there because the vein is burnt, and I have 4 other laser tips broken in my practice. Boss, why are you breaking laser tips, boss? This is not fair. So I keep saying, how many cases have we done here? More than what, 20,000? Yeah. In 20,000 cases of RF I have done, not once has any tip broken. I have never had a foreign body in the patient's blood, and this is what quality is. For this you may pay pay a few thousand more, few thousand less, that's fine. And this kind of blind faith I have, when I have now 14 surgeons operating with me across 21 centers, the blind faith is night 2 o'clock also that machine will fire 120 degrees for 16 seconds and this vein weblate, and every part of it will come out perfectly well. I have never had an implant, or at least in my experience, in my peripheral vascular, not once with Medtronic had I had this. So which is why my relation with you guys also, while so many times I'm back and forth with channel partners, I always say you are anytime welcome to my room, because that's the kind of quality you provided. It's very important. People don't understand this. So if at some point, I don't know, I'm just hypothetically saying this, but just like we say Intel Inside for a computer, we should probably be saying Medtronic Inside for a vascular clinic. And that's because that's a kind of superior chip, same way the Intel chip performs. Right? That's the selling point for Dell computer, not Intel. Right? Intel is sold. Intel is put the chip inside. But the Dell's sale point should become that. Right? That's one. Second story I found funny was some guy for a glue, competing glue, he was presenting and said, "Sir, please use my product AO." And I said, "Do you have any study?" And the study open kiya. And they did some 760 patients. And there are 3 deaths. Re bhaiya, glue karke 3 logon ko maar diya aapne. So I got so scared, right? I mean, whereas we use, hundreds and thousands of glues we have done, right? We've done more than 10,000 glues. We'll never encounter such situations with venous seal, for example. So I think what I tell my doctors, my technicians was, don't compromise on the quality. Your patient, doesn't matter if 5 rupees more or less, but you have to give that quality. Only then the guy comes back. Healthcare quality is very, very important. So I think these words should go out to the public. They should look for that kind of a thing, which is why I was very, very keen on creating the partnership, because we need to tell the third party, the fourth party, the fifth party, the other people watching us, that we are creating a center of excellence. So center of excellence creates good doctor, that's fine, but also requires good vendors, good quality of equipment, good, stuff that never breaks down, stuff that never fails to work, ever. Did we ever have a machine stop? Did we ever have an RF machine stop, ever? Our ultrasound has stopped a couple of times, but did we ever, in 20,000 surgeries across 20 cities, never had the machine stop once? Not once. Support. I call him within 1 day, the guy fixes it. So I think these things make a tremendous difference in our lives. I think that's what we should take home. And please, I goad you to, standing here, I have my own projections, but standing here, by end of 5 years, the number of varicose vein surgeries in this country will go up 10 times. Not mine alone, but I'm just saying overall. So that's a kind of, in 4 or 5 years, that's a kind of business vertical you're looking at. That's a kind of thing. So I think you should keep that in mind and work very hard towards creating this whole lovely atmosphere, the ecosystem, as I call it, that we create. For example, Medtronic ane company undi.
Okay.
మీరు బయట వస్తూ చూసుంటారు.
Yes.
We have an official partnership with Medtronic. Okay? ఈ మెట్రానిక్ అనే కంపెనీ ఏంటంటే, ఒక ప్రోడక్ట్ అది తయారైనప్పటి నుంచి అది మార్కెట్లో తేడానికి 8 ఏళ్ళు తీసుకుంటారు. 8 ఏళ్ళు. 8
సంవత్సరాలు.
యావరేజ్ రీసెర్చ్ టు బెంచ్ టు మార్కెటింగ్ టైమ్ ఆఫ్ మెట్రానిక్ ఇస్ 8 years.
ఓకే.
ఎందుచేత అంటారు? ఎందుచేతంటే వాళ్ళు దాని మీద రీసెర్చ్ చేస్తారు. ఫస్ట్ పిల్లుల మీద చేస్తారు, ఎలకల మీద చేస్తారు, తర్వాత మనుషుల మీద చేస్తారు, తర్వాత నాన్ ఇన్ఫీరియారిటీ స్టడీస్, సుపీరియారిటీ స్టడీస్, ఇలాగ 100 స్టడీస్. ఆ స్టడీస్లో 100 కొద్ది పేషెంట్స్ మీద ట్రై చేసిన తర్వాతే మనకు రిలీజ్ చేస్తారు. ఇది అమెరికాలో, ఈ కంపెనీ స్థాపించింది అమెరికాలో. సో అమెరికాలో మోస్ట్ స్ట్రాంగెస్ట్ రూల్స్ ఉంటాయి, మనం లేకపోతే ఎవరి ప్రయోగాలు చేయకూడదు. సో వాడు ఆ టెస్టులు చేసి అంత ఖర్చులు పెట్టినప్పుడు వీడు ₹2 ఎక్కువే ఉంటాడు, నేను కాదన్నా. కానీ నేనేం పెట్టుకున్నానంటే ఈ ప్రోడక్ట్సే వాడతాను.
ఇది దేనికి వాడతారు సార్? ఇప్పుడు వారికోస్ వెయిన్స్ అనే సబ్జెక్ట్లో దీన్ని ఎక్కడ యూజ్ చేస్తారు?
సో ఈ పుల్ల లాంటిది లోపలికి పెట్టేసేసి, ఈ పుల్ల లాంటిది మన చిన్న సూది మార్గంలో లోపలికి పెట్టేసేసి, ఓకే, మీకు ఏం చేస్తామంటే ఆ లోపల బర్న్ చేస్తాం. ఇది లేజర్ లాంటిదే.
ఇదే మెయిన్.
ఇదే మెయిన్, కాకపోతే దీన్ని రేడియో ఫ్రీక్వెన్సీ అంటాం. ఓకే, ఇది ఆన్ యావరేజ్ 53,000 రూపీస్. ఇక్కడ మీకు వెనకాల రేట్ కూడా ఉంటుంది, నేను కనిపెట్టింది కాదు, రేట్ కూడా ఎక్కడ ఉంటుంది. సో సరే, మనం 100, 50 కొంటే వాడు 5,000, 3,000 తగ్గిస్తారు. ఇప్పుడు ఇది 50,000 కన్నా తక్కువ ఉండే అవకాశం లేదు. సో ఎవరైనా మీకు వ్యారికోస్ వెయిన్స్ ఆపరేషన్ 30,000 చేస్తామంటే అర్థం ఏంటండి? ఇది వాడట్లేదు నంబర్ 1. నంబర్ 2 ఏంటంటే అది ఇంకోటి ఎవరిదో వాడేస్తున్నాడేమో, అది కూడా మనకు తెలియదు. సో ఇది ప్రాబ్లం అండి.
మీరు అన్నట్లుగా ₹1 ఎక్కువ అయి ఉండొచ్చు, బట్ క్వాలిటీ అనేది చాలా ఇంపార్టెంట్ కదా.
నేను ఈ తప్పు ఇంకోటి వాడనే లేదు ఇప్పుడు దాకా. 8 ఏళ్ళగా ఈ మెట్రానిక్, ఇన్ఫాక్ట్ నేను వాళ్ళందరూ వచ్చారు, నేషనల్ టీమ్ అంతా వచ్చారు. We signed the first partnership. Medtronic ఇండియాలో మాతో పార్ట్నర్షిప్ చేశారు.
I'm getting to the next phase of signing the collaboration agreement between Medtronic and Avis Hospital. So for that